We have to unravel sleep and chronic pain and fibromyalgia. So 2018, we did a database search here at Texas Center for Lifestyle Medicine, and we found that most people with fibromyalgia actually had significantly abnormal sleep studies. And some of them, their sleep studies are just slightly abnormal, but it's abnormal enough for us to pay attention. So there's got to be a relationship, right? There is. So a lot of people with fibromyalgia and chronic pain and TMJ issues, tend to have issues with sleep quality. And part of the reason may be because that there's an airway related issue. So what is the airway? The airway is the way that we breathe into our nostrils, into our sinuses, down into our mouth, our tongue, our teeth, our palates. These create the opening structure of how air gets into our body. And as it goes down further into our throat, into our lungs, this is how we get oxygen, and this is how we breathe out carbon dioxide. Well, the problem is a lot of people have impairment in airway issues. This is a really common thing that's there. And so what happens is if some people, especially with fibromyalgia and TMJ issues, they have airway issues, the brain triggers this TMJ and the muscles around it to contract and use the teeth as a fulcrum to open up their airways, to kind of grind forward, open up the airways, and the neck arches like that. You see that in babies, teenagers, adults. You see that in all sorts of humans do that at nighttime. And as you kind of do this, you're trying to open up the airways and issues and the airways there. So over time, your body kind of learns to do this movement repetitively. And your fascia, which is the connective tissue over your muscles, they get tighter and tighter and tighter, and your neck is right here, and your chin's forward, and your head's kind of forward. And this posture changes over time, and the development of this can turn into a lot of pain. Not only can it turn into a lot of pain, it turns into a lot of mental health issues, discomfort, brain fog, fatigue. Sometimes it can lead to significant memory issues, attention issues. And whether it's short-term attention or long-term attention, short-term memory or long-term memory, these are big deals. And these are things that we're seeing even kids start to develop, especially through ADD and ADHD, anxiety, bipolar. We're seeing all these different names that are there that's describing a psychological pattern that may be rooted in the airway issues. And when you have airway issues, your brain won't let you sleep. And here's why. If you have constricted or small airway issues, your brain will trigger these muscles contract. Well, to do that, you can't be in deep sleep. So your body naturally doesn't like to get into deep sleep because it's preparing for airway issues to occur, especially at nighttime. So over time, you go through sometimes years and years and years without good, adequate, restful, deep sleep. And that itself can trigger a lot of things, especially with chronic pain. It can make chronic pain worse. It can make brain fog worse. It can make memory issues worse, attention issues worse, sometimes emotional stability. Sometimes you can have outbreaks with emotions, and sometimes you just want to cry. And that affects the hormones, and the whole world becomes discombobulated when the sleep is actually disrupted. And so on top of that, a lot of people tend to have dental issues where maybe their teeth doesn't line as properly. Maybe they're biting through bite guards. Their dentist is making them over and over again try to open up the airways. But we have to address sleep and airway as a primary thing to improve people with chronic pain. In fact, at the Demystifying Fibromyalgia conference, we have a board-certified neurologist and sleep neurologist that's actually going to be talking about how improving deep sleep can actually reduce pain and improve quality of life significantly in people suffering from airway issues and fibromyalgia and TMJ, etc., etc. Although this may seem far-fetched, but maybe not, but actually improving deep sleep can improve our health. Go figure. It can prolong our lives. It can improve our quality of lives, and that's what I really enjoy seeing. I hope to see you at the Demystifying Fibromyalgia conference here in Houston, Texas, coming up shortly.